everyone. We're going to get started now. So thanks for joining us today for the Provincial Human Services and Justice Coordinating Committee webinar on Community Safety and Wellbeing Planning. My name is Tasha Rennie, and I'm the Network Engagement and Communications Officer for the HSJCC Secretariat. Before we get started, I wanted to go over a couple of things about today's webinar. So we'll be having a Q&A period at the end of the presentation. So if you have any questions, please type them into the chat box throughout the presentation, and we'll try to get to as many as possible at the end. The webinar will be recorded, so a link to the recording as well as the PowerPoint presentation materials will be emailed to all of our attendees at the end of the presentation. So if you're having technical difficulties, please rest assured that you will receive the slides and the recording. We'll also be sending out a brief evaluation survey following the webinar, so we'd ask that you fill that out just to help us plan our webinars better in the future. For anyone who is joining us for the first time, the HSJCC Network is made up of 39 local committees, 14 regional committees, and 1 provincial table. Each HSJCC is a voluntary collaboration between health and social services organizations, community mental health and addictions organizations, and partners from the justice sector. So our presenters today are Steffi Anastasopoulos, Claudia Tenuta, and Emily Jefferson of the Public Safety Division of the Ministry of Community Safety and Correctional Services. And so with that, I'll be passing it over to our presenters.
Thanks so much, Tasha, and thank you so much for having us here today. So this is Steffi speaking right now. I'm going to start off the presentation and then pass it off to Claudia later on. For her section as well. We're just going to get the presentation here up on screen.
So Tasha, I'm not sure if you might be able to assist. We're seeing your slide at this point.
Perfect. Let me just make sure that we can. Perfect, okay. All right, so today we're just going to provide you with a brief overview of the 3 phases of the Ministry's modernized approach to community safety and well-being. And specifically, we're going to highlight the 3rd and final phase, which includes the community safety and well-being planning framework, which is a collaborative approach to planning and service delivery at the local level. We're going to highlight the new legislative requirements related to community safety and well-being planning under the Police Services Act. And finally, we're going to provide you with an overview of the provincial tools and resources that are available to municipalities and their partners to support community safety and well-being planning. And specifically, we're going to highlight the Ministry's risk-driven tracking database and how this can be used to inform the planning process. Sorry, just give us a second here to move to the next slide.
There we are.
Sorry. Okay, we're there now. Perfect. So the following slide provides a bit of context as to how we've gotten to where we are today and the work that has supported the new legislation. So over the past few years, the Ministry has been working with its interministerial, policing, and community partners to develop the modernized approach to community safety and well-being that addresses crime and complex social issues on a more sustainable basis. So this work was done in 3 phases, and each phase resulted in the development and release of a booklet. All these booklets can be found on the Ministry's website, and the links to these are included in Appendix A of this presentation. So the first phase involved raising awareness, creating dialogue, and promoting the benefits of proactive and preventative approaches to community safety and well-being. So this was done through the development of our first booklet called Crime Prevention in Ontario, A Framework for Action, which was released broadly in 2012. This booklet sets the stage for how the province sees effective crime prevention and community safety and well-being. The second phase involved the strategic engagement of various stakeholders across the province, including the public. So during this phase, Ministry representatives traveled across the province and conducted over 30 community engagement sessions with various communities. That included urban, rural, remote, and Indigenous communities. So this resulted in the development of our second booklet, which is called Community Safety and Wellbeing in Ontario, a Snapshot of Local Voices. And this was released broadly in 2014. So the booklet highlights feedback from those engagement sessions regarding locally identified challenges and promising practices related to community safety and wellbeing. So you'll notice at this time that there was a shift in language from crime prevention to community safety and wellbeing. And the main reason for this is that traditionally crime prevention is seen as primarily a police responsibility. However, what we know and what was validated through our engagement is that ensuring the safety and well-being of our communities requires more than just one sector or agency alone. So in order to broaden our engagement and better reflect the roles of various other sectors, we've shifted our language to community safety and well-being. And now the third and final phase involves the development of our third booklet called Community Safety and Wellbeing Planning Framework, a Shared Commitment in Ontario, and this was released broadly in 2017. This booklet was developed as a resource to support municipalities, First Nations, and their planning partners as they undertake the community safety and wellbeing planning process. So it includes two components. The booklet includes the community safety and wellbeing planning framework, as well as a toolkit of practical guidance documents to assist communities as they develop and implement local plans. And so most recently, the Ministry has updated the booklet to include reference to the new legislative requirements related to community safety and wellbeing planning. And the revised booklet also includes a new critical success factor that highlights the importance of cultural responsiveness in the planning process, and as well as includes a new tool to assist municipalities with the engagement of local Indigenous partners. Now, the booklet also incorporates feedback from 8 pilot communities that tested components of the framework and booklet, and toolkit, to ensure that the booklet was as practical and helpful as possible, and to ensure that it included a local feedback before its provincial release. And a significant learning from the pilots was the importance of municipal leadership in the planning process. So specifically, if those communities who tested the framework and toolkit, those communities where the planning process was led by the municipality or had strong municipal involvement actually showed the most success. So then that they had a clear lead and they were better able to engage their multi-sectoral partners. So this feedback really helped inform and validate the new legislative requirement for a municipality-led community safety and wellbeing plan. And also the booklet also includes feedback from the Ministry's Interministerial Community Safety and Wellbeing Working Group, which consists of representatives from 10 different ministries and the federal government. And this feedback ensured that another multi-sectoral lens was applied to the booklet. So here on this slide, we have the Community Safety and Wellbeing Planning Framework. So the framework begins with the understanding that ensuring the safety and well-being of our communities cannot be achieved by one agency or sector alone. It's a shared responsibility between all members of communities. So we need to bring together all the relevant partners to the planning table to plan collaboratively for the risks and needs of our communities in a more strategic and holistic way. So this requires taking a more integrated approach to service delivery to ensure that those in need are receiving the appropriate response. So we need to shift away from reactive, incident-driven responses towards more proactive, preventative approaches that focus on the long-term benefits of social development, prevention, and risk intervention. So to ensure that priority risks are being addressed from every angle, communities need to plan in 4 planning zones, and these are depicted on the slide here in the middle of the slide. So the 3 outer zones represent more proactive, preventative measures, whereas the red zone in the middle represents a response to an incident that has already occurred, such as a crime or emergency situation. So the idea here is that we want to plan more in the 3 outer zones in order to reduce the reliance on and need for the red zone of incident response. There are also 3 areas where communities need to refocus their efforts in order to apply this framework. And these 3 areas are listed on the slide on the left here. These are collaboration, information sharing, and performance measurement. So for each area, a different level of focus is required depending on which zone of the framework you're working in. So next, I'll walk through each zone in a bit more detail. So first, we have the red zone, and this represents our traditional responses to crime and emergency situations. So this includes our traditional first responders, such as police, fire, and EMS. The zone involves immediate reactive responses to incidents that have already occurred, whether they be critical, such as a crime, or non-critical, such as a child being expelled from school. So in this zone, there's limited collaboration taking place amongst emergency responders and limited information being shared, which is generally focused on the incident at hand. When measuring performance in this zone, we focus on traditional enforcement-driven measures, such as number of calls for service or response time. However, these are outputs instead of outcomes, and none of them tell us how safe our community is as a result of the actions we're taking. So as you know, police and emergency responders are often called to respond to complex social issues that are non-criminal in nature. However, many of these situations, such as someone suffering from a mental health crisis, may be more appropriately addressed through a collaborative service delivery model that leverages the strengths of other partners in the community, such as, for example, police responding alongside a mental health worker through what are known as mobile crisis response teams. So as we know, we invest heavily in this zone, and although it's necessary and important, it is reactive and enforcement-driven as opposed to being preventative. And resources could be better utilized, reducing the amount of incidences requiring enforcement in the first place. So the yellow zone here involves addressing situations where individuals are at immediate danger of experiencing harm, also known as acutely elevated risk of harm. This is when individuals are at the cusp of something bad happening, and if something isn't done quickly to mitigate that risk, then they're going to fall into the red zone of incident response, and emergency response will be required. Oftentimes, individuals facing acutely elevated risk are experiencing multiple risk factors at the same time, and as a result, a multi-sectoral response is needed to mitigate these risks. So an example of a multi-sectoral response in this yellow zone are situation tables, which I'm sure many of you are familiar with. So situation tables include representatives from various agencies that provide acute care services, such as mental health, addictions, or transitional housing. And these different agencies come together to discuss the immediate risk factors facing an individual and connecting them to resources in the community. And individuals need to be connected to services within 24 to 48 hours in order to prevent harm and preventing them from falling into that red zone of incident response. So in this zone, collecting risk-based data on situations of acutely elevated risk can help point to some of the systemic issues in the community or gaps in services that may need to be filled. And the Ministry's risk-driven tracking database is one tool that we provide free of charge to help communities in collecting this risk-based data, and we're going to go through that in a bit more detail in a bit. In terms of performance measurements, outcomes in this zone are focused on the effectiveness of multi-agency efforts in reducing high-risk situations. And positive outcomes in this area might include things like a reduction in emergency room visits, a reduction in victimization rates, and an increased access to and confidence in social supports. So the blue zone here focuses on prevention and involves addressing locally identified risk factors before they escalate and result in crime and victimization. It involves proactively implementing evidence-based measures, policies, or programs to reduce locally identified priority risks to safety and well-being. So in this zone, information should be shared among partners that points to trends in crime and risks within the community and points to specific groups, populations, or neighborhoods where these risks are more prevalent. Communities may also look to engage non-traditional partners who are not experts in crime prevention, but may have a role to play in keeping their communities safe and healthy. So for example, this might include local businesses who may participate in developing a strategy to address high retail theft in the area that they may be experiencing. In terms of performance measurement, outcomes in this zone are focused on the results of prevention efforts in reducing and preventing local priority risks. So for example, positive outcomes would include things like an increased feeling of safety, an increase in participation rates, and a reduced fear of harm. And then finally, we get to the green zone, which is where we want to be. So this zone involves making long-term investments to improve the social determinants of health, or in other words, improving the underlying conditions that shape our daily lives and build safe and strong communities. This zone is about addressing those complex social issues such as poverty, homelessness, and mental health through long-term multi-sectoral approaches. It's about ensuring that individuals, families, and communities are healthy, are educated, have housing, have employment, and have social networks that they can rely on. It also involves ensuring that all members of the community are aware of the services available to them and can easily access these services when they need. In this zone, collaboration takes place in ways that challenges institutional boundaries, which means all sectors are working together and sharing information. So this zone involves focusing on improving the quality of life in communities, which can be demonstrated by measuring quality of life indicators, such as an increase in health status, an increase in educational attainment rates, and an increasing competency of individuals to solve their own problems with the assistance of agencies and organizations in the community, as opposed to relying solely on the police. So now that we've planned in each of the 4 planning zones, you'll notice that the red zone has gotten smaller. And what this is demonstrating is that the more effectively we plan in the 3 outer zones, which are more preventative, the less we can rely on and need the emergency response in the red zone, and the more we can improve the safety and well-being of our communities. Now, the ministry has identified 7 critical success factors which have been validated by local communities that should be taken into consideration in order to successfully engage in the planning process. And we're going to walk through each of these briefly. So first, we have strength-based. So we know that communities are already doing a lot of great work at the local level to address safety and well-being. And the planning process is about working collaboratively to utilize the resources, expertise, and experience that already exists in the community in a more strategic and holistic way, rather than reinventing the wheel. The second one is risk-focused. So local plans should focus on addressing risks, not solely reacting to incidences. And specifically, the plan should be focusing on risks that data, research, and consultation show are the most prevalent in their community. Third, we have awareness and understanding. So everyone in the community needs to understand the role they play in making the community a safe and healthy place to live. So therefore, it is important to promote awareness and understanding of the purpose and benefits of having a strategic, long-term plan to address priority risks. Next, we have commitment at the highest level. So community safety and well-being planning is a community-wide initiative and requires the dedication and input from all members of the community. However, it is especially important to have buy-in from individuals of influence in the community, such as political leaders or key decision makers, who can champion the cause and ensure that all the appropriate partners and resources are dedicated to support the planning process. Next, we have effective partnerships. So strong and meaningful partnerships should be built with multi-sectoral partners as part of the planning process. Due to the complex nature of many of the issues that impact safety and well-being, it's important that partners are working together to ensure comprehensive solutions are being developed. Next, we have evidence and evaluation. So communities need to use research and evidence to inform the entire planning process. And specifically, research and evidence should be used in 3 ways. It should be used to identify the risk factors that are most prevalent in your community. Research and evidence should also be used to select the most appropriate strategies to be put in place to address these risks. And then finally, research should be used to evaluate whether strategies are successful in achieving their outcomes and making communities safer and healthier. And then finally, we have cultural responsiveness. This involves effectively interacting with and responding to the needs of a diverse group of people in the community throughout the planning process. So communities should tailor programs and strategies to the unique needs of different groups, as well as to address the distinct risk factors they face. So now I'll briefly walk you through the steps in the planning process. So the pie-shaped wedges in the middle of the slide here represent the high-level steps needed to develop a plan. So specifically, communities are going to need to identify their priority risks, they need to determine their outcomes, they'll need to select their strategies, and then they're going to need to implement and review the plan. So I'm going to walk through each of these steps in a bit more detail. And the ministry's 3rd booklet includes tools to assist municipalities at each step of the planning process. So first, we have identify priorities. So to do this, communities will need to engage local agencies, organizations, and service providers from different sectors, as well as members of the public. Communities are also encouraged to consult and engage with vulnerable groups, such as marginalized communities, including First Nation communities. Communities will also need to gather local data from multiple sources to help identify their priority risks. And this would include leveraging existing data that is already being tracked and collected by different sectors. So together, all the data that you've collected from these different sources and the engagement from your community will begin to tell a story about the risks and concerns in your community. Then once your priorities are selected, communities will need to identify the vulnerable groups that are most at risk of being affected by this priority risk, which risk factors put people at risk of the larger priority. And then finally, the protective factors to put in place, which will help mitigate the negative effects of being exposed to that risk factor. Next, planning partners should develop outcomes and performance measures that will help track the progress of the plan and whether it's having the intended effect on the community. Communities should ensure that outcomes and performance indicators are achievable and where data is available to measure. And this includes identifying short, medium, and long-term outcomes. Next, communities will need to select strategies to put in place. So specifically, planners should use research to select the most appropriate evidence-based strategies to put in place to achieve the identified outcome. And by using research, communities can ensure that evidence-based programs and strategies are implemented which have been proven to have the desired effect on the community. Planners should also leverage existing assets, services, and resources in the community when selecting strategy as opposed to reinventing the wheel. So for example, planning partners can redistribute or realign community resources in a more strategic way to address any identified gaps in services. As previously mentioned, communities should ensure to implement strategies in each of the 4 planning zones to ensure that they, in fact, reduce the reliance on incidents or emergency responses. So we need strategies in social development, prevention, risk intervention, and emergency response. And then finally, communities will need to put their plan into action. So this can be done by developing an implementation plan that specifies things such as roles and responsibilities and reporting mechanisms. So who is doing what, when, in which zone, who is reporting to whom, final reporting schedules, and things of that nature. So communities will need to continue to monitor the progress of the plan on addressing risks by reviewing and updating the plan on a regular basis to ensure that it continues to be reflective of the community's needs. So for example, with time, some risk factors may be reduced and other risk factors may become more of a priority, and the plan needs to be updated to ensure to reflect these changes. So the ministry has received positive feedback from communities who have already engaged in the planning process regarding the benefits that they are starting to see or expect to see as a result of their work. So some of these positive benefits are listed on the slide here. And for example, they include enhanced collaboration among sectors. So this type of planning really reduces the silo approach to planning and service delivery and brings everyone together to share responsibility for the safety and well-being of our communities. Another positive impact that we see is the transformation of service delivery. So this type of planning helps identify gaps or duplication in services in the community and assists in achieving better coordination of services to truly address the needs of individuals and families in the community. So now, as many of you may be aware, new legislative requirements related to community safety and well-being planning came into force on January 1st of this year under the current Police Services Act. So the legislation now mandates every municipality to prepare and adopt a community safety and well-being plan. The ministry is also encouraging First Nation band councils to undertake community safety and well-being planning. However, recognizing their unique needs and varying levels of capacity, they will not be required to do so by the legislation. Municipalities will have 2 years from the in-force date to prepare and adopt a plan, so in other words, by January 1st, 2021. And under the legislation, the responsibility to develop a plan applies to single-tier municipalities, lower-tier municipalities and counties, and regional municipalities. This is based off of how a municipality is defined under the Police Services Act. So for example, in a regional municipality, the region is responsible for developing and adopting a community safety and well-being plan, not the lower tiers within that region. Municipalities also have the flexibility to develop joint plans with surrounding municipalities or First Nation band councils. So developing joint plans may be especially beneficial for municipalities that have shared services or that may lack capacity in order to leverage other resources. The legislation also outlines additional requirements for community safety and well-being planning, including establishing a multi-sectoral advisory committee. So the advisory committee must include representatives listed on the slide here. So specifically, representatives must include LINS, or health or mental health services, educational services, community or social services to youth or children, custodial services to youth or children, municipal council member or a municipal employee, and the police service board or detachment commander or delegate. Now, it's important to note that this is just the minimum requirement, and municipalities have the discretion to include additional representatives on the advisory committee as they see fit. Municipalities can also leverage existing committees or planning tables within their communities that have the required representation instead of creating a new committee or duplicating efforts. Municipalities will also be required to conduct consultations not only with the advisory committee, but also with members of the public, including youth, members of racialized groups, and First Nations, Métis, and Inuit communities, as well as with the organizations that represent the interests of these groups. The requirements for the content of the plan are also outlined in legislation. So specifically, they include identifying priority risks in the community. So these priority risks should be identified through the use of information and data from multiple sources, including Statistics Canada and any other local sector-specific data, as well as with information collected from consultation. So priority risks can include, but are not limited to, systemic discrimination and other social factors that contribute to crime, victimization, addiction, drug overdose, and suicide. The content of the plan also has to include strategies to reduce those prioritized risk factors. So this might involve implementing new programs or services, or it just might involve better coordinating or realigning existing programs and services to address gaps. And then finally, the content of the plan also has to include measurable outcomes in order to determine how successful the plan is in reducing or preventing those risk factors. So the ministry has recently introduced a regulation related to the publishing of community safety and wellbeing plans. So this regulation requires municipalities to publish a completed plan within 30 days after adopting the plan. The plan needs to be published both online and in print upon request, as well as any other manner that the municipality deems necessary. Additional requirements for the planning process, such as monitoring, evaluating, reporting, and reviewing, may be outlined in regulations at a later date, and the ministry is currently beginning the process of developing these regulations, and we'll keep our stakeholders updated as we move forward in this process. Now I'm just going to pass it off to Claudia, who will talk a little bit more about our provincial support and resources.
Thank you, Steffi. The provincial government has recognized that in an effort to support communities that are now mandated to implement community safety and well-being planning initiatives, that we required some level of engagement and support and resources for the communities that are doing this great work on the ground level. Steffi has already spoke about the 3 booklets that are available, and the links are included in the appendice that will be distributed with the presentation after the delivery today. You're welcome to look at that material. They're also available publicly online for anyone interested in reading the contents of any of those 3 booklets, and they do provide a clear breakdown of how to walk through the community safety and well-being planning framework and the process to help communities as they adopt this work. The ministry is also responsible for the delivery of a number of grants to police services and nonprofit agencies. We have undergone a grant transformation in our unit to better align with the work that we're doing with regards to community safety and well-being. Additionally, we heard that many communities that are starting to work collaboratively and looking at ways of introducing integrated service delivery, that sharing information among sectors seems to be the most significant challenge. In an effort to assist communities in driving this work, we proactively at the ministry reached out to the Information and Privacy Commissioner of Ontario, and in consultation with them, we're successful at releasing a document called the Guidance on Information Sharing and Multi-Sectoral Risk Intervention Models. This document was released in August of 2016. It is publicly available and is included in the appendix. Additionally, the Ontario Provincial Police partnered with Laurier University, and they released Situation Table e-modules. Again, included in the appendice is a link where any individual can access this training free of charge to help introduce the concept of situation tables if communities choose to introduce this as a mechanism to collect and address those situations of acutely elevated risk of harm. We are aware of communities across the world that have accessed this training as far away as New Zealand. And we highly encourage anyone who is interested in learning more about this model to access that resources as we in our team have all done so, and we find it a very useful tool. Lastly, in an attempt to provide some sustainable funding for communities that are introducing multi-sectoral risk intervention models, the Ministry is funding the Risk-Driven Tracking Database project. This is a project that has been led by myself since inception in May of 2014, and it is a database that's provided free of charge to any community that would like to access it in support of collection and analysis of risk-based information. I'm going to be spending the remainder of the presentation outlining some of the results to help support community safety planning through the collection of this risk-based data in the RTD. The Risk-Driven Tracking Database, or the RTD as I'll refer to it moving forward, provides a standardized means of gathering de-identified information on situations of elevated risk for communities that are implementing multi-sectoral risk intervention models such as situation tables. We do like to stress, however, this is just one tool that will support these models by helping communities collect data about local priorities, evolving trends, and essentially to assist with the community safety and well-being planning process. We do encourage communities to access and leverage the existing data sources that many of their sector partners have within their community, and we'll be speaking a little bit more about that at the end. The Ministry did leverage the work of our partners in Saskatchewan to develop a customized solution that meets Ontario's needs. As a result of this partnership, Ontario data elements align with other jurisdictions across Canada, so we now have risk factors that are nationally comparative and really allow for some analysis as we broaden this model across the country. As of January of this year, we have onboarded 47 sites across Ontario onto the RTD. We expect that there will be 53 by the spring of 2019, and we continue to offer this database to any new community that decides to implement a multi-sectoral risk intervention model for the collection of this information. I'm going to now move forward in terms of the analysis of the information that we are able to collect through the RTD. And this information is available to communities that have adopted a situation table. They have access to a number of reports and dashboards within the RTD in order to essentially deliver these same results at a local level. However, we will be providing these results provincially, and they will be specific to our 2018 provincial results. So I ask you to keep that in mind as I move through the remaining slides relative to these results. Last piece of information I do want to speak to with regards to the database itself. It is a Microsoft product. It's Microsoft Dynamics CRM. It's web-based, and it does allow for operational functionality at each table at the local level, as well as support from our internal provincial team to provide technical support in the delivery of this product. So as it relates to the results, as I indicated, 47 sites have been onboarded since January of this year. That has resulted in 2,855 discussions being collected for the 2008 provincial year. 18, I apologize. What that means is that within the calendar year that has just ended, we have had partners that have implemented a situation table bring forward nearly 2,900 discussions of individuals that they feel meet the threshold of acutely elevated risk. Of those conversations that are brought forward by an individual agency partner, partners that come together at a situation table need to, upon consensus, determine that acutely elevated risk of harm does exist and does require multi-agency collaboration in order to reduce that risk and stop the need for an emergency or incident response. 91% of the discussions that are being brought forward or were brought forward in 2018 did meet that threshold of acutely elevated risk as determined by those agency partners. Of those discussions that met the threshold of elevated risk, 74% resulted in the overall risk being lowered to an individual or families. And what that means is that when individuals are offered services, when they are undergoing a complex set of risks or faced by a situation which ultimately puts them in a crisis situation, they do accept the help. It's not that individuals aren't 74% of the time looking for help, but in fact that they just don't know where to turn when facing a crisis. Of those situations that meet that threshold, 20,035 risk factors are identified when those sector partners come together and identify risk factors. What we know is in order to determine and to establish that threshold of acutely elevated risk, sector partners need to establish the fact that there is a need for multi-level collaboration because of a multitude of complex risks that an individual or family is facing. And on average, we see 8 risk factors per discussion that are being brought forward. In addition, this results in an average of 6 agencies per discussion that come together and decide on an effective intervention strategy that will help reduce that risk. In addition to collecting some of that core information that I spoke to, we are also recognizing at a provincial level the type of sector engagement that is resulting as a result of this model. The originating sector is the group of individuals or agencies that come forward together in order to bring a situation forward for discussion. At an agency level, local partners can determine what are the top agencies that are bringing forward situations in order to discuss that level of acute need. However, provincially, we recognize that that number could be skewed based on demographics and population size. And so we look at that data from a sector perspective. And if you look at the pie to the left, what we see is that often when people are in crisis, the first place that they will turn is usually an emergency response or 911. And what that shows us in looking at that pie chart to the left is that oftentimes the justice sector is the sector that most frequently is bringing forward situations to a situation table. Nearly 60% of the time in 2018, provincial results show that the justice sector is the originating sector. Despite this, we know that often when people are in crisis, the agency that is bringing forward a particular issue to the forefront isn't necessarily the sector that's best positioned to lead an intervention and find solutions to assist that individual in crisis. The pie chart to the right shows us that when that discussion takes place during multi-level collaboration, we see that the sector best positioned to lead an intervention is not the justice sector based on those identified risk factors. We see, in fact, the health sector is best positioned to lead the intervention, followed by community and social services, and 17% of the time only, we see the justice sector leading. While these results are extremely important, we need to stress that this model does not indicate that ultimately the justice sector is handing off individuals that are in crisis to the health sector and stepping away from the situation. What this model promotes is how sectors can work differently, collaborate more effectively, and look at integrated solutions towards service delivery that reduces the overall risks to individuals that are facing complex needs. That brings us to the next slide, which scopes out the overall sector engagement that's necessary under this model. And what this slide shows that while in the purple areas of this bar graph, the originating sector is definitely still justice, lead sector is largely reduced in the justice sector. We do notice, in fact, that the assisting sector, from a justice capacity, is still heavily engaged. This just speaks to the need for community partners to recognize how, under a traditional model of enforcement, reactive results are different than the proactive approach to social development and integrated service delivery by all sector partners towards the same common goal. We're now going to shift our focus to risks. The risk-driven tracking database collects 105 risk factors that are consistently applied across province. Those 105 risk factors are then broken down into 27 categories that identify priority needs for individuals that are coming forward to a situation table. When we look at the 2018 provincial results, we see that 14% of the time in those 20,035 risk factors that were reported earlier, mental health is the most significant issue. Criminal involvement is second, followed by drugs, and then thereafter you will notice that results are relatively close in scope within the remaining 27 categories. If you look at the figure to the right of this same slide, you will notice that when we break down the risk category by discussions, of the 2,597 discussions that met that threshold of acutely elevated risk and required that multi-level collaboration, 82% of those discussions had at least one mental health risk factor involved. So 82% of all discussions had some level of mental health engagement as it relates to the individual's risk factors. Drugs were represented 42% of the time, followed by risk factors relating to criminal involvement, antisocial negative behavior, and housing. So to the left, you'll notice risk factors relative to how frequently they occur, and to the right, you will notice risk factors as it relates to the number of discussions for which each of those categories were present. Steffi spoke earlier when she spoke about the effectiveness and the ability to plan that we needed to identify priorities. In order to identify priorities, the most vulnerable group needs to be identified as well as risk factors. This slide, when looking at provincial results in 2018 relative to RTD data, shows that for those situations of acutely elevated risk of harm that come forward to a situation table, 22% of the time, those discussions relate to individuals between the ages of 40 to 59. Then we see 30 to 39 as the second highest, 18% of the time, and 12 to 17 years of age, approximately 18% of the time. If you look to the bottom of the slide, you will notice the regional breakdown. And what we see here is East Region and Northwest Region, 12 to 17, outline who is most vulnerable in those specific regions. West and Central is 40 to 59 years. And then in the Northeast region, we see that breakdown as 30 to 39. Why this is important is, as Steffi indicated earlier, we need to be flexible in looking at the local needs of each respective community in order to establish what priorities might be most significant in a given local area. That flexibility needs to be determined locally based on a number of data sets that will help drive and inform the priorities relative to that community. We take this data now one step further. And if you look at the results to the left, you will see that we've now taken the risk categories for those aged 12 to 17, top 5, 1, 2, and 3 specifically, are identical to the overall risk factors for all age categories. However, when you look at the top 5 risk categories for 40 to 59, we see that there's a bit of a variance from the overall 2018 results. Physical health has now moved forward to the third highest, followed by housing. And again, looking at these results, we just need to stress that once you identify your most vulnerable group, you need to recognize that the risk factors facing that particular age group may be different than the larger set of risks that are facing an entire community. Again, there needs to be flexibility as to the strategies and programs that are put in place relative to males and females as well, or your target population specific to sex. So again, if you look at the results for 12 to 17 or 40 to 59 and have consideration for the sex of the individual, you will notice again those priorities might be slightly different, and those considerations should be made when implementing strategies and programming that might be relative to that particular target group. We also stressed earlier and need to consistently stress that there are a lot of data sources that currently exist across Canada and across Ontario. These are public data sources that are available in many instances, including Stats Canada, as well as a number of different open data catalogs that are available through the Ontario government. We encourage communities to leverage the existing data of the partners that they will be bringing forward as part of their advisory committee, and ensure that when they are identifying their priorities, that they're not considering those priorities through a very narrow data set, but leveraging the existing sector-specific data to inform the strategies and initiatives that they will be implementing in each of the respective 4 zones when undergoing community safety and wellbeing planning. Once those priorities are identified, strategies and initiatives should be considered. And again, there are a number of data sources specific to that area of work. Looking at slide 25, you will notice a number of different resources again that are available. We'd like to highlight specifically the crime prevention inventory that was released by Public Safety Canada last year. This is an inventory that is outcome-based. It is the first of its kind across Canada, where they brought together outcome-based programming that help in crime prevention needs that have been tested as best practices and that they encourage communities to look to if they identify that those programs would be beneficial in their community to implement locally toward the same outcome. The inventory does allow for searches that can be refined based on a number of different criteria, including target groups or individual program offerings. We highly encourage you to take a look at that inventory as it is a very valuable source across the country. We now want to open up to any questions. We recognize we have just over about 10 minutes of time, and we're happy to take any questions from anyone that's interested.
Thank you so much, Claudia. Yeah, so we'll invite all of our attendees to type in any questions you have into the chat box, and I'll just read them out. So just take a minute here to allow everyone to enter their questions if they have any. So we have one question here. So they're asking if there are any specific types of pre-existing tables that the community safety and well-being planning is intended to amalgamate or build on, perhaps such as VAWCCCs, STAR tables, etc.
Do you mean in relation to the advisory committee?
I'm not really sure. So I guess that's all I have from this question.
Well, in that context, we definitely encourage communities to take a look at what already exists in terms of planning tables or multi-sectoral collaborations, and if possible, definitely leverage those committees or those tables and morph them into that advisory committee capacity. Again, if that's doable and if it has the appropriate representation or can be modified to have that. We don't want to create additional work or have these partners coming to multiple different tables if it's possible to be more efficient and use one existing body. We have heard from communities that, for example, some situation tables have a steering committee, sort of a governance table that has a lot of that representation already in existence, and so we've heard that they may be looking to leverage that as their advisory committee as part of the planning process.
And we do understand that each community kind of has different resources and committees and tables that they can leverage and utilize. So it really is up to the community in terms of what they have available to them that they feel they can leverage for this process.
As part of the community safety and well-being planning process, you will notice, if you look at the materials that we do have in the booklet, we speak about one of the exercises in planning is to complete or is recommended to complete an asset map. And oftentimes when asset maps are completed, we recognize the existing tools and resources that already exist in communities. So again, that allows the opportunity for all of those partners to recognize what tables or existing committees exist that they can in fact leverage. The one recommendation I would have is to look at the community safety mandate to see and ensure that the existing committees have what is required as part of that advisory committee. So it clearly scopes out who needs to be part of that advisory committee, and if these existing steering committees or other groups that already exist have that representation at a minimum, then we definitely suggest leveraging those.
Okay. Great, thank you. I'm sure that's definitely of interest to a lot of our HSJCC members. So just a reminder to our participants that the presentation materials will be made available to everyone. So I've had a couple questions about that. Another question, someone is wondering if it's possible for academic researchers to obtain access to the de-identified data in the RTD for purposes of applied research.
We are in the process of getting our annual reports. We've released an annual report for 2016 and 17, and we're in the process of getting those published online through our ministry website. So those should be published, we hope, at least in the coming month or so, and that is available for anyone that would like to look at that. We are also exploring the possibility of posting through open data. With a change in government, there has been a change in requirements, and we're just waiting for those new requirements to be put in place so that we can ensure that we meet those requirements and then explore the possibility of posting some of our more historical data through open data. So we're doing our best to do so, and there's definitely some thought that's been put to that.
Okay, great, thank you. Another question here. So they're saying with respect to engaging some partners, they've seen a few issues with some partners behind the confidentiality issue, saying that they can't engage or be a part of the table, I guess, and they specifically cite ambulances and paramedics. So I wonder if you could speak perhaps to confidentiality issues?
Yeah, definitely going back to that information sharing guidance document that I spoke about earlier, which is included in the appendix when it's circulated subsequent to the presentation. We have worked, again, proactively with the IPC with regards to the sharing of information. And information can be shared among partners under this model if it's done in the disciplined approach for which it's outlined in that document. So there's a 4-filter approach to information sharing. It speaks very clearly around what kinds of information should be shared in a very de-identified way. And if the model is used as outlined within that guidance document, there are no concerns from IPC's perspective or any restrictions under the legislation, be it PHIPAA, FIPA, or MFIPA, to share information for the purposes of reducing harm to an individual that is at that acute level of risk. As it relates to EMS in particular, I can tell you that there are a number of situation tables that have representation from EMS. I know that every table really locally has to determine what partners will participate and the level of comfort from those respective sectors. Where there may be concerns from a respective EMS partner, we do have a community of practice that exists across Ontario where over 45 different situation table chairs come together on a monthly basis to discuss successes and challenges that are working locally at their table and to essentially assist each other where there may be issues with, for example, the sharing of information. EMS issues around engagement, if there is a local table that's having problems, I highly encourage them to bring that forward locally to either the steering committee or to the situation table chair. And I know that those chairs are very good at engaging with their provincial sector partners to identify how that's worked in other communities and essentially implement it in their community successfully. So it's been done, it is being done. There are a number of tables that have EMS representation, and I highly encourage communities to work together towards solutions so that EMS can be engaged.
Okay, great, thank you. So I have a question here regarding LINs. They say in some areas LINs are active on tables and during plan development, but in some areas they are not. It appears that there is a problem with communication between some ministries with other tables. So they're wondering how well how this legislation is being communicated. I wonder if you could speak to that at all.
So we, as the ministry here, we do have an interministerial community safety and wellbeing working group. So it includes representation from 10 different ministries and the federal government. And we have worked with this interministerial group in order to ensure that information related to community safety and wellbeing planning, the new legislation, and any work supporting that, that they are aware of that, and they also disseminate our information to their respective group and stakeholders, et cetera, et cetera. So we have, representation from the Ministry of Health, and they have been involved in kind of trying to get their stakeholders on board as well. In terms of the LIN specifically, I think it depends per, each individual community needs to determine, which are the groups that, whether it be LINs, because in the legislation it does say that it can be either LINs or a mental health or health representative on the advisory committee. So it is up to the, the local community to determine who is most appropriate to sit on that advisory committee and provide the expertise that is required.
Also, with regards to sector engagement, we've done our best whenever there's a request from a respective stakeholder, whether it be directly from a LIN or from our interministerial partners, to do presentations such as we're doing today. We will happily engage with those sectors to provide presentations across the province. If there is a gap in information relative to your local community, you are more than welcome to reach out to any of us and we will help bridge that gap. In addition, we know that there's a lot of ministries that have disseminated our information with regards to webinars that we're having over the course of the next 2 months. Those webinars began yesterday, but will be continuing forward until May. There is still a lot of availability for some of the future dates if anyone is interested in participating in that in a webinar. All of the webinars are the same. They're offered in English and French, and they are available if you're interested. Again, reach out to Steffi, myself, or Emily, and we will give you those specific dates. And it breaks down the community safety and well-being planning process in more detail than you might have seen today.
So with these webinars and with our continued engagement with, various sectors and other ministries, we are continuing to, spread the word about this and about the community safety and wellbeing planning process and what it entails.
Great. So I think that is pretty much all of the time that we have for today. So I see that your contact information is on the slide here. So hopefully, if our participants have any other questions, they can contact you all directly. Is that okay?
Yeah, absolutely. Yep.
Okay. Well, thank you so much for joining us. That was a really great presentation, and thanks to all of our attendees for joining us today as well. And I think we'll end the webinar here. So have a great day, everyone.
Thank you. Thank you for having us.
Thanks.
Bye.